before we begin the next topic, you will need three things: pen and paper in order to respond to starter questions, write down your notes and respond to exam questions, and your phone, and in particular the timer feature to ensure you're giving yourself the correct amount of time to respond to the questions. Now, the purpose of these sessions is that you should feel more knowledgeable in 1 hour's time. And if at any point during this session you do not understand anything, it's your responsibility to pause the video, rewind, rewatch. Without any further ado, let's get to it.
Hanging the balance, and it's on his defense to try to get off the field.
And the Wolverines are running back from the 16-yard line. On the move, Brad Hawkins.
There's Cam Jones, came in. They did call a targeting.
So throws a little bit too fast for his own good. Nice contest, but a foul. Paul George playing basketball, whether you are working out on your own or whether you are
paid to go to a ball game. And Jennings took that one. Let's hope he's okay. The ball ends up out. Wow. And it was caught. Jennings is up and is being held up by Jared Saltzman.
Wow. Oh boy.
And let's hope that Dan Jennings is okay.
Wanted us. You were crying out that you bypassed the harder team in Miami Heat.
Roach came down bad on his left foot. See him holding on to his knee, and down. The left leg. Keep an eye on the left leg. There. Yep. When he planted, that's when whatever happened. Let's see here.
Yeah, it's before he comes down. It's the plant right there on that left leg.
There was some give. There was some give on that knee, and you could.
the 0-1. Oh, that got him, and it got him in the face. Yep. Oh my goodness. Oh my God. Squaring around the bunt. Fastball at 95. It did get the helmet. Did. And thank God for that.
So welcome back to Learn with Mr. James. Over the next half an hour, we're going to explore the identification and treatment of injury. I previously mentioned that drugs is one of the most enjoyable lessons, and I think this runs a close second at being one of the most enjoyable lessons within the GCSE or EDEXCEL GCSE specification. So, again, the objectives are to explore the various hard and soft tissue sporting injuries associated with physical activity and sport. The key words are concussion, fracture, dislocation, strain, tennis elbow, golf elbow, strain, abrasion, and torn cartilage. So as always, we have 3 questions to perhaps widen our understanding or just get us ready for learning. Question 1, tricky. You've just watched a video highlighting some of the most memorable sporting injuries. Describe the difference between a fracture and a dislocation. 2 marks. Trickier. Explain using an example the role of one item of protective equipment used in football. 3 marks. And trickiest. It was widely reported that Anthony Joshua suffered a concussion in his defeat to Andy Ruiz. Assess the negative impact of concussion on the performance of a boxer. For 3 marks. You have 5 minutes. Set your clocks on your smartphones or devices. Give yourself only 5 minutes. I'll see you after you've completed the questions. So welcome back. Mark scheme responses. For question 1, a fracture is a break or crack in a bone. A dislocation is an injury at a joint where ones are forced out of their normal position. or where bones are forced out of their normal position. Remember, when you're ever asked to describe the difference, all you simply do is define both terms. Question 2. Protective clothing and items are vital for contact sports. 1 mark. Shin pads are an example of protective item used in football. 1 mark. Therefore, performers are less likely to sustain fractures to their lower leg or to their shin bones for the final mark. And trickiest, a concussion, we've defined it, is a temporary brain injury due to a blow to the head. 1 mark. A concussion affects the brain's function for the 2nd mark, and this negatively affects the performance as it limits their ability to avoid punches for the final mark. So the following criteria will determine how successful you are in today's lesson. So if you know and describe the different types of soft and hard tissue injuries and respond to AO1 questions only, you're working at a grade 2 to 3. If you can explain how injuries can specifically occur in sport and methods of treatment, plus responding accurately to AO2 questions and AO1 questions, you're working at a grade 4 to 5. And if you can evaluate the impact of hard and soft tissue injuries on performance, responding accurately to AO3 questions, you'll be working at a grade 7 and above today. So first thing we're going to look at is the identification of injuries. So we have hard and soft tissue injuries. Injuries can be classified as soft or hard tissue. Hard tissue injuries are injuries to bones, and soft tissue are injuries which involve damage to skin, muscles, tendons, ligaments, and cartilage. So it's very simple. Hard and soft. Think about the actual material. Is it soft or is it firm? And that will tell you if it's a hard or soft tissue injury. We begin with hard tissue injuries, and image 1 is a clue for our very first injury. So for those of you who worked out the clue, our very first hard tissue injury is concussion. A concussion is a sudden but short-lived loss of mental function, and is an injury normally caused by a blow to the head and can happen in many sports. Symptoms of a concussion are headaches, dizziness, nausea, vomiting, seeing stars, unconsciousness, confusion, and temporary memory loss. Treatment for concussion is to always seek medical help. That's doctors, that's nurses, that's hospitals, as the injury could indicate something more severe such as brain swelling or a bleed on the brain. So demonstrate your understanding of concussion through the following tasks. So question 1, which of the following performers is greatest at risk of a concussion in the activity? For 1 mark, we have a table tennis player, footballer, or dancer. And question 2, define a concussion and describe how this could occur in a sport you selected and how it would be treated for 3 marks. So in total, 4 marks in total, 5 minutes. Let's go. Hard tissue injury number 2. This is the image of the injury we're about to explore. And those who would been able to work that out is a fracture. A fracture is a broken bone usually caused by a violent impact. They are most common in contact sports like rugby or sports where there is a risk of falling from a height or at speed. So sports such as horse riding, skiing, and rock climbing. Fracture should be treated by immobilizing the injured area with a splint or sling. Immobilizing just means to ensure that it stays still, to keep the injury or keep the injured area still. The casualty should not be moved until a doctor arrives or nurses or medical professionals arrive. There are 2 types of fractures. A fracture can be open or closed. A closed fracture means that the bone is cracked or broken, but the skin isn't broken. So essentially, the bone is enclosed within the skin. An open fracture means that the skin is broken and the bone is protruding out, is sticking out of the skin. Now, as you probably can imagine, that has a greater risk of infection future amputation, because if that bone is protruding out of the skin and it makes contact with bacteria, this could obviously lead to an infection of the bone, which could lead to an amputation. Hard tissue injury number 3. And for those of you who were able to work that out, that was a dislocation. Now, when a bone at a joint is forced out of its normal position as a result of a hard blow, this is known as a dislocation. Okay, and it causes the bones to be displaced. Now, the symptoms of a dislocation include deformity, swelling, bruising, numbness, and pain. And the treatment, very similar to a fracture, you require immediate, urgent medical assistance. Now, demonstrate your understanding of fracture and dislocation through the following task. Wheelchair basketball is a recognized Olympic sport. Paralympic athletes work as a team to progress the ball to the opposing half and score baskets. Assess the impact of knee dislocation and a humerus fracture on the performance of a wheelchair basketball player. Now, to my left, I have included an image of the humerus. As you see, it's the bone in the upper arm, just to help support responses. You will receive 3 marks for tackling the knee dislocation aspect of the question, and 3 marks for tackling the humerus fracture, the second aspect of the question. You have 8 minutes. Let's go. Soft tissue injuries. The first soft tissue injury we're going to look at is an abrasion. Now, an abrasion is also known as a graze, and it's caused by friction of the skin against a rough surface. So, for example, a concrete playground, or everyone's had a graze when playing on AstroTurf, especially the sand AstroTurf. Now, it usually results in a scab, and it obviously is quite quick to heal. The injured area should be cleaned and avoid any dirt entering, obviously, which would cause an infection. The next soft tissue injury we have is torn cartilage. Cartilage damage is relatively common. It often involves the knee, although joints such as the hips, ankles, and elbows can also be affected. It can become damaged as a result of sudden injury or gradual wear and tear from long-term overuse. Now, for those who remember the career of Tottenham legend Ledley King, he suffered from torn cartilage and cartilage damage as a result of him playing football throughout his career. It meant that in his final seasons with Tottenham, he wouldn't even train with the team. He would train in a swimming pool to sustain his fitness and then play on match days. It was so painful for him to actually compete. That is why he took these drastic measures to ensure he only put pressure on his knees when he was participating in a match. Just to give you some background context of cartilage, cartilage is a tough, flexible tissue found throughout the body. It covers the surface of joints, acting as a shock absorber, allowing bones to slide over one another. If we did not have cartilage, imagine putting your knuckles together, okay, and you're rubbing them. That would be the friction feeling you would have, okay, when your bones at a joint, when your bones obviously come together. So cartilage is very important. The symptoms of cartilage damage include joint pain. This may continue even when resting, swelling, stiffness at the joint, clicking or a grinding sensation, and could actually lead to the joint locking, catching, or giving way. So demonstrate your understanding of abrasions and torn cartilage in the following question. Question 4. Which of the following sports poses the greatest risk of torn cartilage in their activity? Archery, speed skating, or equestrian, which is a technical term for horse riding, or competitive horse riding, for 1 mark. Question 4b. Justify the sporting activity you have selected for the above question for 2 marks. And question 5. Define the term abrasion and describe how this could occur in the sport you selected and how it would be treated. All of these questions, you have 5 minutes. Set the time in your application. Let's go. Okay, so this image shows the soft tissue injury number 3. This is what we call MRI scan. An MRI scan for a sprain. Sprains only occur in ligaments. Now, ligaments are strong bands of tissue that connect. This is the most important thing. Ligaments connect bone to bone. They connect two bones together. You have a range of ligaments through the body. You'll probably most commonly have heard of the ACL. This is the ligament which connects the femur to the fibula. This is the ligament which actually forms the knee joint. Now, why you would have perhaps heard of this is that this is a very common injury in football to tear their ACL. So a sprain happens when the ligament, which connects bone to bone, is stretched too much or it tears. The symptoms include pain, swelling, bruising, and it could be more severe and leave you unable to move. And the treatment, most sprains can be treated with rice. Now, I'm going to touch upon rice later on and actually, in fact, explain it in full. But we're going to call it rice for now because I'm going to go into it in 2 or 3 slides time. So explain, so demonstrate your understanding of sprain knowledge through the following question. Explain why sprains are common sports injuries in activities such as netball and football. 3 marks, 5 minutes, let's go. The fourth soft tissue injury that we're going to explore is a strain. Now, I need you to be really disciplined here because a strain sounds very similar to a sprain. However, it has a different meaning. So be very disciplined, be very precise here now in your definitions. Now, strains only occur in muscles or tendons. Now, a strain often occurs when muscle fibers stretch or tear, and it's usually the result of muscles being stretched beyond its limits and forced to contract very quickly. Now, muscle strains are particularly common in the legs and back, such as hamstring strains, lumbar back strains, quadricep strains. Now, the symptoms associated with strains are swelling, bruising, redness, pain, obviously, and muscle spasm. So that is a strain, more concerned here or only concerned here with muscles, sometimes tendons, nothing to do with ligaments. Be very precise. The next soft tissue injuries that we're going to look at, the next 2 injuries we're going to look at, involve the elbow. And we have tennis and golfer's elbow. So both injuries are a result of stretching or tearing a muscle or tendon around the elbow. These conditions can cause pain around the elbow, obviously. And they're what we call a overuse injury. Now, the names give it away. A tennis elbow is commonly experienced by a performer participating in tennis, and a golfer's elbow is commonly sustained by a performer who participates in golf. Now, it's overuse is that same stroke movement over and over again can cause an injury. Now, just to be clear, how do we differentiate tennis elbow from golfer's elbow? Now, tennis elbow happens at the outside, okay, the outside of the arm, whereas golfer's elbow is on the inside of the arm. Okay, so be very precise. Tennis and golfer's elbow sound very similar. Essentially, it's the same condition, but on 2 different sides of the arm. So how to treat and avoid injuries. So I said we was going to explore this. We're now at RICE, and RICE stands for rest, ice, compression, and elevation. And this is the process which should be followed to treat minor injuries, or most commonly treat soft tissue injuries. Now, rest, ice, compression, elevation. That is what RICE stands for. So R for rest, stop, training, you need to relax. Ice, apply ice to the affected area. This could be with an ice pack or a bag of frozen peas, but you have to apply a cold compress to the damaged area. And this provides pain relief and limits swelling. That's very important. Pain relief and to limit the swelling, reducing blood flow to the surface of the skin. The C of RICE stands for compression. Use pressure to hold the ice pack on the injury. Compression could also be in the form of a compression type item of clothing to reduce swelling, to force the injured area to stay at its normal size. And the E stands for elevation. So you must raise the injured area where possible, keeping the injury level with the person's heart to again minimize swelling. So we can see in the image on the right hand side, we have a person on the sofa injured, and their injured foot is on 2 cushions to elevate the area again, trying to reduce swelling. Now, how to avoid injuries. Now, these are a set of procedures that participants and coaches should follow to avoid injuries or to minimize injuries. So number 1, ensure the training program is designed using the principles of training to avoid overuse injuries. We've seen and explored overuse injuries today. Tennis elbow, golfer's elbow, overuse injuries. Make sure you understand and follow the rules of an activity. That's very important. If you are participating and you are breaking rules, this could lead to injuries. Make sure you use appropriate protective clothing and equipment. Boxers, we're talking about gum shields, head guards when in sparring. Number 4, check equipment before use to make sure it's in good condition. Now, this would relate to apparatus and equipment such as goalposts. If perhaps the foundations of the goalposts are unsteady, that goalpost could collapse, fall upon the goalkeeper. So it's very important to check the equipment before using it, all equipment. Next, number 5, check facilities before use to make sure there's no hazards such as glass. This is quite common over Hackney Marshes. You'll see bottles, on the football pitch. It's very important for the coaches, the performers, the referee to do or perform these checks before the game or training session commences. And lastly, which is very important, which we looked at in physical training part 1, is a warm up and cool down. Okay, that is a very, very, very important way of avoiding injury. So we are now approaching the final hurdle, the final part of today's session. We're going to conclude with a 9-mark question, as we always do. So question 6. Athletes can sustain the full range of sports injuries in track and field athletics, despite it being a non-contact sport. The images below illustrate tennis elbow strain and sprain. Evaluate the impact of tennis elbow strain and sprain on long-term performance for athletes in preparation for the Tokyo 2021 Olympics, for 9 marks. Now, as always, I would like you to structure this, okay, considering AO1, AO2, and AO3 statements. Now, it's a choice of whether you structure this within AO1 and AO2 paragraphs, so that's the 2-paragraph approach, or you want to do the point application method, the PA method. So for AO1 knowledge, we're looking at definitions, okay? Tennis elbow, definition. Strain, definition. Sprain, definition. For AO2, statements or paragraphs, when will the athlete sustain these injuries. Describe the scenario. Use the image to help you. And for AO3 paragraphs, we have to now conclude. The command word here is evaluate, so we're thinking about judgment and opinion. Which injury poses the greatest risk to long-term performance? Which injury could keep an athlete off the track or out of competition for the longest? Alternatives. What other injuries should an athlete consider and safeguard against? Okay. And suggestions. Expand on the procedures athletes can implement. What can they do? What could coaches and athletes do to avoid injuries, or specifically the injuries discussed? Now, I'm going to model this for you by partially completing the 9-mark template. So I am now modeling step by step how students should be approaching today's 9-mark question. So the first thing we need to do is highlight command words, subject, and topic using Microsoft Word. So the first thing we can see is the command word is evaluate. I have tennis elbow, strains, and sprains. Clearly, they are my topics, okay? And my subject is an athlete who is clearly preparing, or athletes who are preparing for the Tokyo 2021 Olympics. Okay. So if I then refer back to the prompts, the sentence starters shared within the PowerPoint, I know that I need to share facts on the topics, and the topics are tennis elbow, strains, and sprains. So a good starting point would be, let me define all three terms. So tennis elbow is caused by overusing the muscles and tendons attached to the outer arm of the elbow. So you would do exactly the same to define strain and sprain. So I've done that now. I move down onto the next section, AO2. Now this could be a paragraph, like I said, or AO2 statement. This could be directly after I've written the statement defining tennis elbow. So I could go along the route of the image shows a javelin thrower, so I'm going to use a javelin thrower. Javelin throwers could sustain tennis elbow in training after weeks of repetitive javelin actions. Okay, this is how the athlete could, this is scenario, weeks and weeks of repetitive javelin actions, repeatedly throwing a javelin could cause an athlete to experience tennis elbow. Now, for the record here, tennis elbow is just an overuse injury of muscles and tendons, and the pain is felt within the outer part or outside of the arm. It doesn't necessarily mean it can only happen within tennis. We move on to the AO3 paragraph. We're looking at the conclusion here. So this question is concerned with the command word of evaluate. So it's very important we make a judgment on our opinion on how we feel. So the opinion that I came to was that, in my opinion, a strain is the most damaging injury an athlete could sustain in the lead up to the Olympics. Now, Running is the foundation of all track and field events, and a hamstring strain will prevent a performer from running for a prolonged amount of time. We're talking perhaps here weeks, months, and this could lead to reversibility. So this is how I've come to my opinion. Now, as long as you justify adequately, you may say that the tennis elbow or the sprain is the most damaging injury in build up to the Olympics. As long as you justify, you come up with a reasonable rationale, you will receive the mark. So I'm not advising that you copy my response. I'm advising that you think for yourself in formulating your opinion. And then you'll follow the key prompts expressed within the PowerPoint for where to go next. So you would move on to an alternative. What other injuries should the athletes mentioned in this question consider and safeguard against? We've learned about a range of injuries in today's session. So think back. What are the perhaps one or two most appropriate injuries which could be sustained from the athletes as mentioned in this question? And finally, you're going to share some suggestions. What procedures could athletes implement to avoid sustaining any of the injuries mentioned today? What could they do specifically? What steps could they take? List a few. So that is my walkthrough to this week's 9-mark question. I hope it's helpful. Please follow my lead in completing this document in full, sharing it with me via email. Again, thank you for watching this week. All the best.